Well, that's where we are next right now. And how far so far? One of the comments made there by one of the civil servants, government should calm down. Well, our guest here this morning will be giving us some perspectives. Dr. Alera Roberts is a consultant public health physician with Luth and CMUL. Thanks for joining us this morning, madam. So,
thank you very much for having me.
Yeah. Let me begin with that seemingly comical response of that civil servant. Government should calm down. Is government calm enough, or you think government is too calm or not calm at all?
I think government has been exceedingly lenient. It gave 49 days notice that this should be done, and people who had anxieties and concerns, which of course they would have, had ample opportunity in that time to have their anxieties and concerns addressed by trusted healthcare providers. And everybody has to see a doctor at some point in their life. They have a family physician, they have a preferred healthcare provider that they go to when they are ill or their child is ill or a loved one is ill. They could have gone to such a person and asked advice and sought advice and looked at the information that is available. But if the government has mandated you to take a vaccine before accessing your work, I like the comment another lady made that it should be by choice. Indeed, it is by choice. You have a choice to take the vaccine or not, and your employer has a choice to allow you into the workplace or not. Everybody has choices, and she chose not to take the vaccine, and the employer chose to exercise their right to limit entry to the workplace. So these are things that I believe that, you know, one by one, every one of us should get our anxieties and concerns addressed and allayed, and then take an informed decision to, as somebody said there, submit themselves to the vaccination.
Perhaps that's the challenge. Communication of this whole thing to people has been a little not persuasive enough for some people as far as they are concerned. Plus, sometimes the responses coming from other people that they took the injection, they took the vaccine, and they had reactions that they were sick for a little while and all of that. You know, some of those things are also things that I don't know if you would agree that government has or has not given enough information to people to, as you said, allay their fears.
You're a communication and media expert. Communication is a two-way process. We talk, you listen. You ask questions, we respond. But if we talk and you don't listen, it becomes a unidirectional thing, and nobody can force a horse to drink when it gets to the river. So, you know, the government has done everything it can do to put information out there. There are health educators and health promoters across the local governments that are working to get people educated. But if people don't want to listen, there's absolutely nothing we can do. But then when this kind of mandates now come up, bearing in mind that personally, I really don't like mandates. I don't like the fact that we have to mandate human behavior. But if that is what it's going to take, then that is what it's going to take. I remember when the government had to initiate the seatbelt rule, you know, and all sorts of things came up. But whether we like it or not, we saw a massive reduction in the number of deaths from accidents within vehicles that didn't have seatbelts. We saw that massive reduction. When government mandated, I mean, there's a mandate on routine immunization of children. Now nobody quarrels. Now we love the fact that we're on the list of countries that have been accredited as polio-free. So we like the benefits, but we're not ready to put in the work. Communication is a two-way thing. There's enough media coverage, in my opinion. This is one such example, for instance, to say that, look, whether we like it or not, until everybody is safe, nobody is safe. Vaccines have to be taken for us to reduce massively the spread of this virus. Otherwise, we're going to continue to live with it. And worse still, every time the virus transmits between human beings, the chances of another mutation gets higher. New variants are being created. So the thing that we can do best is to vaccinate everybody and make sure we can reduce. I mean, I wish I could say stop, but I can't. reduce the transmission of the virus remarkably so that we don't keep getting into this situation just when we think we're out of it.
There are also questions around whether or not we have enough. The latest data, the last time I looked at the data that's available in public domain, says that about more than 6 million people or thereabout, I don't know, no, maybe about 2 million people have collected the first jab, and only about half that same number have collected the second. With the population that we have on our hands, do you think we have enough? And if we do not,
we will worry
what are
about enough when when the doses that we have are exhausted. We can't be worrying about enough when we have doses that have not gone into arms.
Okay.
We have to worry about enough when people have taken up every. If, as the lady said, there was a lady there who did say that they had gone there and it was not available to, or was it the gentleman said to come back today? Please be patient and persistent and get your vaccine. Let me quickly address that issue of side effects. Every vaccine, and every mother of an under 2 will tell you, every vaccine will cause you to have some pain at the jab site, sometimes a fever, some body aches and pains. It passes off in about 24 to 48 hours, most and generally. And we advise everybody, when you get the vaccine, just take 2 tablets of a regular painkiller to forestall those kind of things. But it is far, far better. I can't emphasize this enough. It is far better to have that pain at the jab site and a little bit of fever and body aches than to be in a situation where your family members are running from pillar to post, looking for money for your health care. Please, let's be patient, persistent, and get the vaccine. Please.
Well, there is more on that when we return from this break, Dr. Alero Roberts. Please stay with us. Thanks for staying with us. Well, Dr. Roberts, let's talk about Omicron, the Omicron variant, for a little bit. We understand that, I mean, you have mentioned it just now, that every time there is a human-to-human transmission of this virus, it mutates. And it would seem like every successive mutation gets worse. What do we know about Omicron?
Well, what we know so far, to put it in as plain language as possible, is that this is a virus that the variant of the COVID virus that has undergone as many as 30 mutations on what we call the spike protein coat. Now, the spike protein coat is the part of the virus that has been used to create the vaccines, which can record to what it does is that if you have that vaccine, it allows your immune system to recognize the COVID virus via that spike protein coat. So the worry is, or the concern, I should say, is that if it has undergone as many as 30 mutations on that spike protein coat, number one, do those mutations make it more transmissible? Number two, does that mean that we have more severe disease? Does it affect younger or older or everybody? And is it still immune to the vaccine? Is it now immune to the vaccine? So these are concerns I believe the WHO is giving a press conference later today, where some data has begun to come out. But from what we've seen so far, well, I'm speculating here, but it hasn't seemed to cause severe disease immediately. However, even those who have the Omicron variant version of the disease, who have mild symptoms, we don't know what the long-term effect is. And the transmissibility, we're still not sure if it is more or less transmissible than the Delta variant. So all in all, we're still up in the air about the information, but it is clear that this Omicron variant has been circulating in country and in other countries even before the South Africans recognized it and put it out there in the public space. So that's what we know so far that is of public importance.
Information that will be of public importance is whether or not the vaccines being taken now will be able to deal with Omicron. But let's see if we can get more on that from our guest with my colleague in Abuja. Malpe.
Thank you, Ayo. We have with us this morning Professor Oyinwa Agbara, who is a professor of toxicology, chemistry, and microbiology. He's also the head of Department of Biomedical Sciences at Nile University. Prof, you're welcome to Sunrise Daily this morning.
Thank you for having me, Marbe.
Well, it would seem, I mean, you have seen a lot of the headlines this morning. You've also seen the report filed by our correspondent there that the federal government did try to enforce its own directive. That if you do not get vaccinated, you're not coming into the office, even though I think at some point yesterday that was eventually relaxed, perhaps to give the civil servants a little more time. But from your own analysis, from what you have seen so far, it would seem that COVID-19 itself as an illness hasn't really provided much incentive for people to go get immunized as a result of well, I don't want to say minimal fatalities because, you know, loss of one life is enough, but we haven't seen people dying on the streets as people thought was going to happen if COVID-19 got to Nigeria. So that in itself has been some sort of disincentive. How can we get past that to actually tell people that, look, this is actually a dangerous enough illness for us to get vaccinated for?
Thank you, but yeah, you see, what is happening globally is not just a situation where we have to beg people to get vaccinated. The issue is this virus is here and is here to stay. And whatever thing that is happening with this virus is what viruses do naturally. Last time I was on this program, I talked about that. We continue to see the mutation sequence. What we need to do, yes, the number of deaths globally compared to the number of people that have died in Africa or specifically in Nigeria is very, very low. However, just as you rightfully said, one death is more than enough. What do we need to do is to make sure that citizens, regardless of where you are, where you work, for you to get vaccinated. And the case of this Omicron virus, we don't know the severity of the effect of this virus because it's new. But having said that, what we need to do is to use both pharmaceutical and non-pharmaceutical approach in treating diseases. So when you talk about incentives, what kind of incentive do you need to give to somebody to protect himself? The incentive is to give more information out there so that people will know what are involved when it comes to the transmissibility of this disease and the severity of the virus if you get infected.
Mm. So Omicron was first of all reported by South Africa, but what we now know is that it had been in other parts of the world. I mean, Netherlands came out to say, oh, they already saw Omicron before South Africa came out to say that they just saw it. But however, as a result of South Africa making that announcement, we've seen travel restrictions on you know, countries on the African continent as a result of that. So it would seem that even though the US president has said that what we need is concern, not panic, there have been panic measures, you know, restricting travel. From what we now know about Omicron, should we really be seeing the sort of measures that we're seeing being taken against countries as a result of it?
With all due respect, the UK government, the decision they took, they pressed the panic button, which is very unfair. Because this virus, what the scientists in South Africa did was very, very commendable. That they were very transparent. The virus was first detected in Botswana. I think the first set of travelers, diplomats that came into Botswana, I think the 2nd or the 5th of November, 14 out of the 19 diplomats tested positive to this virus. And they are not Botswanians, they're not from southern part of Africa, they come from somewhere. So for UK government to just press the panic button and impose this blanket restriction on travel for everyone coming from Southern African country is very unfair. What we need to do is to work collectively as internationally to make sure that whatever measure that needs to be put in place in order to control and curtail the spread of this virus has to be done. For example, it's good for us to have herd immunity because since we don't know the severity of this virus, we don't know who has it already. We don't know how long it has been in circulation in Botswana, in South Africa, or even here in Nigeria. I think I read yesterday that NCDC has detected
3 cases now.
So we don't know where those people have been. So when we talk about infection tracing, we don't know where those people have been.
But excuse me, can't we tell? Can't we infer? Because if people had been dying, if new deaths were now being recorded or a sudden spike in the number of deaths were now being recorded as a result of COVID-19, and we now find at the end of the day that it's as a result of this new variant. Doesn't it point us in the right direction? But from what we are hearing, we hear that, oh, it's been mostly in young people, they're the ones who have been affected by it, and that the symptoms have been mostly mild.
Yes, the symptoms has been mild. However, since we know this thus far, we should wait until the next 2 weeks. The most important thing is for us to keep the precautionary measures in place. And if it requires mandatory vaccination, so be it. Just as Dr. Robert said earlier, any vaccine you take, regardless of age, most likely going to have side effect from mild fever, maybe last for about 24 hours or 48 hours. It doesn't matter. So that's why it is nice if when you take this vaccine to take some analgesic to prevent you developing fever. So what we need to do is to make sure that the precautionary measures that we have put in place since 2019 are enforced. Mandatory wear a mask, vaccination. I mean, the death toll in sub-Saharan Africa is about 4.3% globally. And the vaccination is very low, it's about 2.2%. So we need to spread the message out there for people to get vaccinated in order for us to protect ourselves. So, but in the issue of enforcing people not to go to place of work, just as Dr. Robert said, if an employer can make such a decision, you have the right as well not to go to work. But you have the employer as well has the right to say, look, you can't come into this facility if you don't get vaccinated. The bottom line is this, my way, is for us to be cautious, impose the non-pharmaceutical and pharmaceutical measures, get vaccinated. That's the bottom line. That's the only way we can curb this, the spread of this virus.
It's a problem now. You know, when you would say we have to adopt non-pharmaceutical measures, you know as well as I do that wearing of masks is now oftentimes an official measure when people are going into official gatherings or they have to get access into officialdom. That's when they wear their masks. Oftentimes, even within the premises of the officialdom, the masks have been long discarded or no longer in use in marketplaces where even the protocols we put in place for gatherings, no more than 50 people, etc., no more than 50% capacity of the hall, all of that have since been thrown away. And again, I go back to incentive. It will seem that people haven't seen any consequence as a result of that. So they're not really seeing the need for that. How do we begin to really say, look, it is important, even though you are not exactly seeing any consequences as a result of discarding these protocols?
Okay, when people die in the hospital or at their homes, who gives report of what's the cause of death? People are dying every day in this country. Nobody knows what's the cause of death. Since if we don't put in place good record keeping in reporting death and cause of death, we might not be able to say, yes, this person died of COVID or COVID-related symptoms or illness. But the most important thing is this, is for us not to let our guards down. The capacity for NCDC and the government to keep the sequencing of this virus is very important, so that as samples are being collected, the scientists can continue to do the sequencing tracking in order to know when a new variant, if what we have is a new variant or the variant that we are familiar with. So with that, we can be able to prepare ourselves for whatever thing that might come up in the future. The virus is doing what it's supposed to do naturally. They mutate. So, and they're here to stay. Just like the flu virus. What we need to do is to get vaccinated.
Every time the viruses mutate, I have noticed that there's always concern around whether or not the vaccination or the vaccines themselves will remain effective against the new strain that has been noticed. And I know that concern also came up with the Omicron variant when it was discovered as to whether or not the vaccination that had been taken, because a lot of them were still largely in experimental stages. When I mean well, let us not go into that now before I go and say what I'm not exactly aware of. But we do know that these vaccines were the stages were rushed in terms of trying to get you know, the vaccines. I know that the vaccine producers, a lot of them were complaining about the fact that the time given, you know, was not enough, so to speak, to truly test the effectiveness of these vaccines. So that question always comes up every time that there is a new variant. That itself is, for a number of people, poses some discouragement, because if you every time a variant comes up, we have to ask the question whether, you know, this vaccine we've taken is now effective against a new variant. What exactly is, it goes back against the question of incentive. What incentive really is there for those who are yet to take the vaccine to say, I'm going to submit myself to taking this vaccine?
Well, with the issue of vaccine production, I think the basic science has already been established. And for this particular virus, for this particular family, we know how they mutate. We know how they replicate. So with that, the pharmaceutical production of vaccine has been taking place. We have covered that ground. If we're talking about this maybe 12 or 15 months ago, it would have been a different story. But now we know how this virus works. And the vaccines that have been produced thus far are 80 to 90% effective. Regardless, they are from the same family. So the effectiveness of these vaccines are still there. That's why we're encouraging people now to get a booster shot. If you have gotten the second shot, after 6 months, you are advised to get a booster shot. Just like when people take the flu shot every year. So it doesn't really matter. What is important here is that we know how this virus operates. And scientists have developed the basic vaccine to cover prevention and make sure that humans are no longer exposed. Even though if you're exposed to it, if you contract the virus, with the vaccine, you can be fully protected. So that's the most important thing. We should not be worried it's not going to work. Is it going to work or not? The basic science has been covered already. So it works. And I encourage people to get vaccinated and get booster shot.
Okay, so let's take this to Lagos now. I don't know if Dr. Alero has a different perspective on this.
Thank you, Mark. Well, first of all, Dr. Alero, would you want to quickly respond to my colleague's question, so that I have a number of other things to raise with you?
Well, I concur with everything that he has said. The only question that I'm going to ask about people querying the speed of production of a new vaccine is that we don't query the speed of production of a new phone. We'll go out and buy it, or a new plane. We'll jump into it and travel to wherever. Or even a new car. You give me a new car, I'm not going to question how fast it took for it to be produced. The fact of the matter is that the technology exists. Knowledge has exploded in the last 10 to 15 years. So I'm not at all worried about the speed of production of a new vaccine. The technology is there. Computerization has worked. You put in the questions and the algorithms come out and production starts to take place.
Well, interestingly, a new phone, a new car, a new airplane do not go into the human bloodstream, but we'll leave that argument for another time. Well, what is of concern to me
darling,
now?
it can kill you.
Well, agreed. I understand that.
To kill you.
You know, but an argument, well, a conversation that's been going on, and I'm pretty sure that you might be able to speak with it. It's the Yuletide season. Christmas is just around the corner, and a number of people are going to be traveling. You referenced something like that earlier on. And there have been conversations around vaccination for people in the rural communities. How far with that? Because it's part of the reason I mentioned the issue of having adequate conversation with people, informing the people correctly, communicating with them. As you said, it's a two-way street. Do people even understand why they need to take, you know, these vaccines and all of that? So in terms of vaccination for people in underserved rural communities, how far would you say we have come with that?
Well, unfortunately, I'm not privy to the data if it exists as to what the vaccine coverage in rural areas has been. So I shan't even begin to speculate as to what it can be. But it is vitally important that the local governments, the ministers, the medical officers of health in local governments are empowered and strengthened to be able to lead their teams out, particularly their health promoters, their health educators, to go literally door to door, village to village, hamlet to hamlet, and make sure people are educated and vaccinated. And having said that, COVID is a good excuse for us to to deploy resources to that. But don't forget that when they do go out there, they're able to give education on so many things: child nutrition, healthy pregnancies, environmental conditions, and so on and so forth, water, sanitation, and hygiene. So we need to make sure that the primary healthcare system is actually empowered and strengthened to deliver the services that are going to keep rural communities safe. Because you can imagine a situation where, people from the city go back home for Christmas and the Yuletide, carrying the virus with them to unprotected family members, community members. It's unconscionable. And then you have to bear in mind that they're carrying the virus back to unprotected community residents and family members who may have poorer access to healthcare when situations arise. So I think it is vitally important that we look seriously at that community engagement and making sure that the primary healthcare services can deliver on those services.
Do you think the state governments, the subnationals, are by themselves even aware of this, of the severity of what you have just mentioned now, talking about serving the underserved rural communities, these vaccines?
Well, one can point to some states, I don't want to mention names, obviously, but one can point to some states where the state governors are certainly up and doing and making sure that they're using all the resources at their disposal to ensure that people in the communities are served. And this is not just with health, it is also with education, because don't forget that at that level, you've got a multiplicity of sectors that need to work hand in hand. You've got health, you've got education, you've got environment, you've got housing, you've got road transport, you've got works and housing, you've got power, you've got agriculture, to make sure that everybody comes together to ensure that the services are available to protect community residents. Because in protecting anybody from disease, it's not just a physician's job, really. Has the person eaten well? Are they properly housed? Do they have access to healthcare? Do they have roads? Can they farm safely? Are they secure? Are they safe? Is there water? All these things have to. So you can point to one or two states, well, more than one or two states, a few states that are up and doing. And you can point to quite a few other states, and you wonder, do they even have an executive governor who cares about the people?
Well, we have to thank you very much for all the information that you have given us. I mean, being a public health physician, definitely the passion is understandable. Dr. Alera Roberts, consultant public health physician, thank you so much for your time this morning.
Thank you so much for having me.
All right. Malpe.
Well, we still have Professor Wangwara here with us, and there have been complaints, though, even while we're trying to get people to go out there, getting the services to the people when they do go out is very important. There are those who are complaining that they cannot get the vaccines, or those who have gone for first shots who say that the booster shots are not available. So, for instance, the Moderna vaccine, for instance, a lot of people have been saying they've not been able to get it. The complaints are getting rare, particularly in Lagos. What should the authorities be doing? Or should there be a feedback mechanism for this sort of complaints to be able to get to them?
Well, in the distribution of drugs or vaccine, the supply chain, there should be a very robust inventory. How many vaccine doses has we received? How many has been administered? With that, just like if you have a store and you sell products in your store, when the inventory is low, you restock. Unfortunately, in this case, it doesn't work like that. We have to place the order ahead of time. Nigeria is not the only country that is in need of this vaccine. The vaccine supply, there's inequality in the vaccine supply in developing countries. We all know that. And that's why World Health Organization is lamenting to make sure that the developed countries, the rich nations, are able to supply this vaccine to developing countries. So what we need to do is to make sure that those that have received the vaccine, the first shot, and once the second shot, we cannot just say, if we receive, let's say, 2 million doses, and we have administered 1.5 million doses, we know that in the next few days or few weeks, the 500,000 doses remaining will be exhausted. Now, the issue that what government has to do is this, to make sure that there's a restocking in the supply. But unfortunately, I don't know where the lapse is coming from. I cannot say for sure. Those in authority might be able to shed more light on that.
Well, Prof, we have to thank you so much for sharing your thoughts with us this morning. Professor Oyinwagwara is a professor of toxicology, chemistry, and microbiology. I want to believe that those who are, in charge of ensuring that, the vaccine stock is restocked, at least till we exhaust what we have in country, will do what they need to do. Prof also heads the Department of Biomedical Sciences at Nile University. Prof, thank you once again for sharing your thoughts with us this morning.
Thank you for having me, my way, and have a happy holidays.
Well, we're going to be here. Thank you very much, Prof. We're going to be here throughout the holidays as is to serve the people. We have to say that we'll be here.